If you don't treat a UTI or if you ignore it too long, a couple of problems can happen that can be serious. So UTIs are more common in women than men, and one of the reasons for this is because the pathway from the outer part of what's called the urethra, that's the tube that comes from the bladder to the outside, is very short. So it's easy for bacteria to ascend into the bladder and then begin the process of creating an infection. Well, the most common symptoms of a UTI are going to be somewhere along the lines of lower abdominal discomfort. And you're going to see things like painful urination or urgency, which means that when you feel like you need to go all the time but only have a small amount come out. Also, sometimes you might see some blood in the urine or some discoloration or odor, or the urine may appear a little bit cloudy. That's going to be your most common symptoms. What we do when patients come in with complaints of a possible bladder infection, we're going to run what's called a urinalysis. That urinalysis can be done quickly on site. It's basically a microscopic exam of the urine. We look for evidence of white blood cells, which are more numerous in cases of infection. We also look for bacteria, and we do chemical testing of the urine to see if there's certain types of chemicals that are present if there are bacteria and white cells around as well. The most common treatment for UTIs is going to be antibiotics, and usually that's an oral type antibiotic, and you take it for 5 to 7 days depending on the severity. One reason that we have problems with infection of the bladder is because it's so close to the inner thighs and the rectal area where bacteria is very common. We have to distinguish, of course, between lower urine infections, which is the bladder, and upper urinary tract infections, including the kidneys. Kidney infections are much more serious. Patients who have kidney infections sometimes will have higher rates of fever and back pain. And a lot of people think back pain is associated with just a simple bladder infection, but rarely is that the case. But if you are having back pain, it's more likely you might have a kidney infection, which we need to get treated immediately. So if you're having symptoms of urinary tract infection, you need to come see us so that we can make that diagnosis and get you treated fast.